Namaste and welcome. Today we are going to talk about bipolar affective disorder. Bipolar disorder is characterized by changes in mood over several days, weeks, or months. The mood may fluctuate between depression on the one hand and mania on the other hand. When a person experiences only depression, it is termed unipolar depressive disorder. If this depression is also associated with manic episodes, then it is called bipolar affective disorder. In bipolar disorder, during a phase of depression, the person may experience anergia, that is, loss of energy to do any activities. There is also low mood, that is, feeling extremely sad. He or she may also experience anhedonia or loss of interest in previously enjoyed activities. There may also be biological features such as loss of appetite, weight loss, sleep disturbance, especially getting up very early in the morning, menstrual changes in women, and sexual difficulties. Psychological features include a sense of hopelessness, worthlessness, and helplessness, feelings of guilt, and having suicidal ideas. On the other hand, an episode of mania is characterized by high energy, restlessness, and doing unwanted activities. There is also elevation of mood, that is, the patient may feel excessively happy and start singing and laughing for no reason. He or she may also be irritable, and this may lead to verbal or physical outbursts. There may be appetite changes and complete disruption of sleep, that is, the patient may not sleep at all, and there may be high sexual energy. Psychologically, the patient may feel that he or she is a very important person, a very rich person who is capable of doing anything. In extreme cases, this may lead to a false belief known as Grandiose Delusion. One of the key features of a manic episode is loss of insight, that is, the patient may believe that he or she is mentally well and that he or she does not require any treatment. There are several risks associated with having bipolar disorder. During the depressive phase, suicidal thoughts may be very severe and the patient may attempt suicide. During the manic phase, the person may become very irritable and angry and attack others verbally or physically. Sometimes a patient in manic episode may believe that he or she is very rich. He or she may buy a lot of items that are often not necessary. As a result, he or she may end up in financial difficulties. Since the patients believe that they can do anything, they can drive recklessly on the roads and cause accidents. Due to the high sexual energy, they may also take part in unwanted sexual acts with strangers, leading to unwanted pregnancies and sexually transmitted diseases. Treatment in bipolar disorder depends on the phase of the illness. If the patient has depression, then antidepressant medication has to be given along with counseling to help the patient cope with the illness. If the person is in a manic episode, then he or she should be admitted to the psychiatric inpatient unit. Counseling will not be very useful for a person in full-fledged manic episode. Treatment in the form of antipsychotic medications or sleep medications would have to be given. These have to be combined with mood-stabilizing agents which will prevent the mood from fluctuating. These include lithium, sodium valproate, and carbamazepine, among other medications. Due to the recurrent nature of bipolar disorder, it is very important that the patient complies with all the treatment. Medications have to be given for several years and sometimes even for life, depending on the severity of the condition and the number of relapses that the patient has experienced. The family has to make sure that the patient is taking medications at the right time and is also attending follow-up appointments with the doctors. If you are having bipolar disorder, stop smoking, drinking alcohol, and taking any other street drugs. It is also important to take part in focused activities. Doing meditation and yoga may help in this regard. Since people with bipolar disorder generally tend to be very creative by nature, it is advisable to take up some creative hobby such as arts, music, or dance apart from continuing with the day job. By following these steps, people with bipolar disorder will be able to keep their mood stable and carry on living a productive life. Thank you for watching this video. Namaste.